my name is Maite Ortega, and the organization that I chose to focus on is the Capital Area Counseling Organization, that is abbreviated as CAC, and they primarily focus in the Central Texas area, and they specifically provide low cost psychotherapy, specifically in where I am living, which is Austin. I decided to look up different organizations that were within Austin, since it is such a large city, and the CAC organization was the one that was closest to my home, so I decided to focus specifically on this organization. So I attempted to make a few phone calls to the organization. However, the young lady who was the receptionist explained to me that because of the amount of people that they saw on a daily basis, they were unable to specifically set a time and date of when they would be able to set a time to see me. So I asked her if I could go and see her and just ask her questions about the organization and what they did. She explained to me that I could. So when I got to the office that is located about 2 miles away from my house, I asked her a little bit about what the organization did and what they focused on, and she provided me with a little bit of information on what they focused on and how they provided counseling and therapy for low income or individuals that make a lower income. So first and foremost, she explained that because Austin is such a large city and the population is growing very fast, there is not enough low-income counseling and therapy, and because of that, there is a wait list. So in order for a patient to be seen at Capital Area Counseling, you need to send an email to their main email where you would provide information on general information such as your name, your date of birth, your availability, and also your telephone number. You would also in the email provide information as to why you want to be seen, any life changes or life scenarios that you are going through that might lead you to feel the way you are, and for that reason you need counseling and therapy. After your email is accepted and reviewed, you are added to the wait list. And she explained to me that the wait list right now will range between 12 weeks to 16 weeks. And after, it could be longer or it could also be shorter depending on the amount of people that are needing the service at the time. After you are off of the wait list, you will be scheduled for an appointment intake where you will be evaluated by a therapist, and they will determine on if they can see you and if it is a service that they can offer to you. So she was unable to inform me specifically on the main reasons why people visit the organization or why people need therapy, but she did tell me that the website actually lists a section where they tell you exactly if you need help with specific things, and these are the items that were listed on people who come to see them. So there is recent and past trauma, experiences of grief and loss, depression, mental health diagnosis, feeling stuck, stress and anxiety, navigating LGBTQ identities, relationships, intimacy issues, family dynamics, life transitions, purposes, personal growth, etc. So I also asked her, after she explained to me what the process is, she explained to me a little bit more on the type of people who work there. So all of the therapists who work there are considered volunteers. So all of the therapists that work there have either a separate full-time job, or they also will help part-time here, but they do, for the most part, all therapists have a private practice and have a full-time job. All the therapists who choose to help in this organization are simply doing it because they wish to give back to the community, and for that reason, they are simply volunteers and they do not get paid. Among the therapists who are there, every single therapist will be in different stages of their professional careers. So there are, like I said, certain therapists who are just there because they wish to provide low-income therapy to the community. But there are also therapists who have recently graduated from grad school or who are in the last years of grad school and are beginning to do their hours. And for a lot of these therapists, this is the first time that they are put in these specific roles and they are able to help individuals who need help and aid. So I asked her specifically on how people are billed, since she did focus a lot, and the organization itself does focus a lot on speaking, or they focus on providing low-cost therapy. I asked her how these people are billed. So specifically, she said that first and foremost, they do not accept any type of health insurance. So you have to pay only by cash. The people who go there will provide their yearly income. Once they provide their yearly income, based on either the pay stubs that they offer, the organization will set an amount for how much each of their therapy sessions will cost. She explained to me that each therapy will range between $10 and $55, and that is per session. So while I was up there and I was speaking to her and giving her questions or asking her questions, there was actually a young lady who went up and she explained, and she overheard me asking the receptionist how much they would charge. And because the receptionist sees so many people, she was unable to give me an exact example. But the young lady that I met, she was 24 years old, and she was also a part-time student. So because she was a part-time student, she was unable to have a full-time job, and her part-time job was unable to offer her any benefits, including health insurance. So she provided her income, and she got paid $14 an hour. And after they summarized that up, they concluded that her sessions would be $15 a week. So something that is unique to this organization is that even though it is a low cost, they do not limit a patient on the amount of sessions that they wish to receive, if that is either on a weekly or on a monthly basis. A lot of these low-income organizations that offer therapy will limit you, so that could mean that you could only be seen for 6 months or a year, or that could also mean that you could only be seen once a month or once every 2 weeks. This organization, however, does not do that. They will not limit the amount of time that you can see them, and it does not limit the amount of sessions that you can get per week. As long as you can afford to pay the amount that they give you, you are able to see them multiple times. The young lady that I met, she would go once a week, and the receptionist explained to me that the most that most people will go is twice a week. So after I really read into the organization, I learned a lot about what this type of organizations offer to such a big city like Austin. First and foremost, with a city that's growing so much, I don't think that there's a lot of emphasis on the amount of low-income programs or low-cost programs that are provided to a city. This is just one example, and because of the amount of people that are moving to Austin and the amount of people that currently live in Austin, the wait list just keeps getting longer and longer. And this is a really bad thing for the community in Austin, because this is something that people should have access to, and because of the price and the lack of access to good health care, a lot of people are forced to be on the wait list, which could be very bad for their mental health. I also learned that There are a lot of other organizations who do this. However, this one specifically gives the patients a lot of access to unlimited amount of sessions. Overall, this organization surprised me because I did not know that there were many therapists who would offer low-cost therapy, and I look forward to learning more about SAC in the future. Thank you.